Our next lecture today, it's going to be talking about a very interesting topic called multiple endocrine neoplasia. I remember when I was in medical school and they taught us this lecture, I had no idea what they were talking about. I just wish they had just said, listen, a guy comes in and I found 1, 2 out of this in their body, neoplastic syndrome. What other one is most likely is going to be there? That's all this topic is all about. It's basically saying if I can find 2 of these symptoms or 2 of these diseases in your body, I should be thinking there might be another one. You have to just be suspicious of it. That's it, guys. Well, let's dive into the party. So when they say multiple, there's more than one thing going on. Endocrine, all the endocrine organs are acting up and they have some kind of neoplastic process. That's it. That's all you need to know. So this is how they're going to test you. There's 3 good types. But before we start, I'm not going to tell you which one we're going to first talk about, but bear with me here. So we're going to take a patient case because I think if we have a patient case, you should be able to understand where we're coming from. So we're going to take a 35-year-old female. Okay? She came in to see our endocrinologist. And during the process, she came in and she's complaining, Doc, I have this chronic peptic ulcer disease that's been going on for years. Let's say 5 years of chronic peptic ulcer. She's been losing weight. She's been taking pantoprazole. So she's complaining of chronic peptic ulcer disease. Now, we've used a lot of PPIs for her, but she said it's not really helping. So somebody said, okay, we don't know what's causing, what else can be causing people to have chronic peptic ulcer? She said, I'm not on any NSAIDs right now. I'm like, okay, that's a good thing, you know, and she doesn't have H. pylori, so we'll knock that out. She does not have H. pylori bacteria that causes peptic ulcer disease. So I said, I want to order a gastrin level on her, and I gave her a fasting gastrin level, and it was very, 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 very high. We did a secretin inhibitory test, and guess what? A gastrin level was still elevated. So we said, voila, guess what, honey? You got Zollinger-Ellison syndrome. Ah, well, that's good to know, which is a gastrinoma. So we found one thing. Well, then she said, then I asked her, have you ever had any problems with your pituitary? She's like, yeah, I had a pituitary tumor resected 4 years ago. I'm like, really? She's like, yeah, I had a pituitary tumor one time. It was a prolactinoma. I'm like, you had a prolactinoma? She's like, yeah, you know, the doctor took it out. Now I'm fine. So before she walks out of the office, I'm thinking in my head, or on the board exam, this is how they are going to ask you. She has Zollinger-Ellison syndrome. That's one thing, we just diagnosed it. She has a pituitary tumor. What other tumor can she possibly have? So she had a pituitary tumor. That was one right there. That's our guy. Supposed to be a lady, but we're just going to use that. All right. And she had a gastrinoma coming from her pancreas, a pancreatic tumor. So guess what? The only thing left is going to be a parathyroid. She's going to possibly even have another parathyroid hyperplasia right there. You know what? Let's draw the thyroid gland and put them in there. So the third thing she's going to develop is a parathyroid hyperplasia. Now, this is not a cancer, it's just hyperplastic. Now, which means they might be having, hyperparathyroidism, right? That's most likely what she's going to have. Hyper PTH. So if I check our PTH levels, guess what? It's going to be elevated. Now, we took all these 3 syndromes that has what? She had a pancreatic tumor, she had a pituitary tumor, and she had a what? A parathyroid tumor. We call them the 3 P's. And those 3 P's are called what? One syndrome called, the first one we first found. We always find all these 3 in a certain amount of patients. So we call them multiple, which there's 3 of them, endocrine neoplasia type 1. But you know who found it? It was Werner's syndrome. Actually, that's not the guy that found it. I don't know who found it, but it's also called Werner syndrome. So the way I remember is it's men 1, Werner's, Werner's. Wait a minute. Werner's sound like one Werner syndrome. So if they want to trick you, they might just put Werner syndrome. That's how you remember. It's MEN 1 Werner's syndrome. Okay, that's how you remember it. So what are the 3 P's? Now we got actually to write them out. This was supposed to be a case. So the 3 P's are 1, pituitary, right? Tumor, parathyroid tumor, and last but not the least, a pancreatic tumor. See that? Pituitary, parathyroid, and pancreas. That's Werner's syndrome. That's how you remember that. 3 P's. Now, our lady, let's continue our story, has a sister. She finished college and she was very, very excited. And she said, I love public health. I just love public health. And I want to go get my master's in public health. So I'm like, that's a great idea, because you know what? This is a familial syndrome. It's usually inherited condition, right? You inherit from somebody. And it's actually an autosomal dominance inheritance. That's how these people develop it. So her sister decided to go get an MPH. And let's see what happens. Our sister decided to come to my office again one day. Not my office, into the endocrinologist's office and said, our sister is 32. She was 35. So when our sister came, her sister was a 32-year-old. They were 3 years apart. Came in and said, Doc, you know, my blood pressure has been out of control. They've given me multiple medications. I just don't know. I get this palpitation. I get very, very sweaty. We're like, really? So, well, she did not have renal artery stenosis. So, and it's not an essential hypertension. So just to make sure she's fine, they did a CAT scan of her belly and they found a tumor on her pancreas. They called tumor of what? Chromatin cells. She had a pheochromocytoma. That's why our blood pressure is always 180/110. They can get a calcium, they give a thiazides, right? They give, beta blockers. Well, not really the best treatment. They should give a phenoxybenzamine, right? It's an alpha-1 blocker. Well, now that we found out she had pheochromocytoma, we thought that was the end of the world. But unfortunately, she said, well, we ordered a calcium level and we noticed like a calcium level was really, really high. Elevated calcium. And what is the most common thing of elevated hypercalcemia? Hyperparathyroidism and cancer. Those are the top 2. Just give me the top 2 right now. So she did not have cancer, thank goodness. But she had hypercalcemia and her phosphate level was very low. So we decided to check a PTH level, and PTH was sky high. Guess what she had? She had another hyperparathyroidism. We were like, wait a minute, you have hyperparathyroidism and you had a pheochromocytoma? I'm a little bit worried for you. I'm very worried. because there might be another thing going on that if we don't pick it up, it might kill you. So we decided to check a thyroid, and they did a biopsy. And guess what else she had? She had an underlying medullary thyroid carcinoma. So while she was trying to get her PH in graduate school, she actually been walking around with the MPH itself. She had a medullary thyroid carcinoma, which is the M. She had a pheochromocytoma, and she had a hyperparathyroidism. It's great that she's getting a master's in public health, but guess what? Her sister had developed Werner Syndrome. However, because she's getting a master's in public health, it's a great idea. She developed this syndrome, and they call it, well, if your sister has the Werner's and she's type 1, that is a type 2. So we call it type 2A syndrome. This is man 2. Well, how do I remember the other name for man 2? So, another name for man 2 is what? Nipples syndrome. Now, this is, if you have a kid in the house, please close their ears. So I said, what two things in the body, right? There are two things in a woman's body that everybody's always looking at. Starts with an S, a nipple. Nipple. I'm like, nipple, sipple, whipple, nipple. Wait a minute, two. There's two nipples, and that goes by sipple. Well, as nasty as it may sound, we don't care because this is medicine, right? We just want to remember stuff. So 2A is two nipples, but it's not the nipple. You have to change that to sipple. That's 2A. But remember, sipple is a sister's name. That's how you remember. Sipple has two nipples, and she went to get a master's in public health. You can't get nastier than this. However, make sure you're only above 18 to be able to hear what I'm saying, because this is not meant for the lighthearted. That's how you remember type man 2A. Because medullary thyroid carcinoma is very, very nasty. You don't want them to have cancer of their thyroid gland. Now, because 100% of these patients are going to develop it. Now, we're not done. We're going to have to talk about their brother. They do have a brother. Okay? Let's talk about their brother, because this is a very nice, beautiful family. And their brother is an 18-year-old male. Since we were worried that sister both have an autosomal dominant condition called multiple endocrine neoplasia, we were worried about their brother. Their brother came into my office, and this guy is a 7'3" tall guy. Tall, lanky, skinny. I'm like, wow, that is Dirk Nowitzki. Well, it wasn't Dirk Nowitzki. So when he came in for a physical. When he came in, we checked his blood pressure, and his blood pressure was 220/100. I'm like, oh. I'm a little worried. You're 18 years old. You should not be having a blood pressure of 220/100. So we eventually did a workup, and guess what he had? He had a pheochromocytoma. Just exactly. It's like, I get sweaty, diaphoretic, tachycardic, right? In the middle of the night, my blood pressure is always elevated. Get headaches too, palpitations, tachycardia, because too much what? Epinephrine being shut out by the tumor in the adrenal gland. Well, we thought we were done. I told you the guy is tall. He's about 7'3". He had Marfanoid habitus. That's what we call that. Okay? So, Marfanoid habitus, tall, lanky. They have Marfan Syndrome. Now, you would think we're done. We said, wait a minute. I want to do a physical exam. I look into his mouth, and he has all these little nodules. They are called mucosal neuromas. So let's break that word into two: mucosas and any mucous membranes in our body. Our nose has mucous membranes. Our mouth has mucous membrane, right? So when we look, and neuromas are what? Tumor of nerves. So inside his mouth, if you look into his nasopharynx, I'm like, what is that stuff sticking out, right? Nasopharynx tumors. You look at oropharynx and the larynx. Now, inside the mouth, he's got all this little tumor kind of sticking out in his nose, right? This is his nose, okay? And inside his mouth, he also has some, like, at the back of his mouth, all this nerve tumor sticking out. Those are mucosal neuromas. Now, that's not going to kill him, right? He has only mucosal neuromas. The guy's tall and lanky, and he's got pheochromocytoma. That is their brother right there. He's a very tall guy. Look at that. He's very skinny hands. So what should you be looking out for? Well, watch out for medullary thyroid carcinoma. That is what is the biggie. Medullary thyroid carcinoma. Okay? Because that is bad. So we have to check that. Do a biopsy and you see it. You made a diagnosis of medullary thyroid carcinoma. But guess what? The only way you're going to remember him is because, well, he's the guy that has a lot of M's and a P. So how do I keep track of Werner's? The older sister, Sipple, with the nipple, which is 2A. And this is called man to be. Well, how do I remember him? Because he's the man to be. He's 18 years old and he's also eventually going to grow up to be a man one day. So he's man to be, right? He's a man to be. Because he's a man to be, he's going to be a male with Marfan habitus, right? He's got mucosal neuromas, medullary carcinoma. He's got all the 3 M's with just 1 P's. So the sister has 3 P's. He has 2 P's because parathyroid, right? And pheo. And the brother only has 1 P. So Werner's got 3 P's. Always remember, Werner's 1, she's number 1. She's the firstborn. Number 2 is Sipple, right? She's 2A. She's the lady with the master's in public health. Always remember that. By the time you get to their brother who's 18, whose name happened to be a man to be. Okay? And that's how you remember. 3 M's and 1 P. Marfanoid, tall and lanky, right? He's got pheochromocytoma, mucosal neuromas. And that's how you remember it. They will give you 2 out of these syndromes and tell you what else are you going to find. And that's how you memorize and understand multiple endocrine neoplasia. I hope you like this family of men, which are actually the Werner's family, the Sipple, and a young guy here who is the man to be. You know, one of them is getting an MPH. The first one has got 3 P's walking around. And this is our last guy, who's the youngest of them all. I hope you enjoyed this lecture. Thank you very much for watching, and have a great day. Bye-bye. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX, or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, Just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, you're able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.